Member for Mornington.
Thank you, Deputy Speaker. My adjournment matter is for the Minister for Health. The action I seek is for the Minister to update my community on any plans for much-needed healthcare investment on the Mornington Peninsula, including upgrading Rosebud Hospital and investing in specialist services like public ophthalmology. Across Victoria, only 65% of 000 calls meet the 15-minute response benchmark, well below the 85% target. Ambulances are ramping outside of hospitals. There's been a 13% spike in hospital-related complaints. More than 42,000 Victorians last year waited longer than clinically recommended for essential care. Locally, there is an urgent need for health investment, particularly at places like Rosebud Hospital. Rosebud Hospital is the closest one for people in the southern part of my electorate. Locals are waiting too long for emergency care, too long for elective surgery, too long to see a specialist. It needs an urgent upgrade that Liberals, led by the member for Nepean, committed hundreds of millions to last election, while Labor, to this day, continue to ignore it. Meanwhile, more so than the big new sign that's been put up at Rosebud Hospital, the awesome staff there and patients just want a roof that doesn't need buckets and hallways that don't need towels to catch water when it rains. What's more, there is also a need for more specialist services, including public ophthalmology. There is none at the moment, none at Frankston Hospital, Rosebud Hospital or anywhere on the peninsula. So accessing public eye care is simply out of reach for many. One such person is Diane in my electorate, who has to travel all the way to Melbourne to access ophthalmology services, taking hours and often spending over $200 on taxis each time, something that she can barely afford and which means she needs to give up other things. This is really unacceptable. Over 26% of the peninsula is aged 65 and over. Eye conditions like cataracts, glaucoma and macular degeneration are common and treatable, particularly if they are caught early. They are the difference between independence and living with a disability or sight and blindness. So why are we forcing the most vulnerable in our community to travel hours, pay hundreds of dollars or go without care? This isn't just a health gap, it's a fairness gap. Imagine being 75, unable to drive with worsening vision. Your only appointment is in Melbourne. So how do you get there? Rely on a family member, pay for a taxi, take 2 buses and a train, or like many people do, you cancel the appointment. And then you fall, you lose your confidence, you lose your independence, all because the care you need was too far away. So we need these urgent specialist services on the Mornington Peninsula. We need urgent investment in places like Rosebud Hospital. These things shouldn't wait any longer, and I call on this Labor government to take action.